I want to spend some meaningful time talking about 4 key principles that I've discovered that really are the things that are holding my patients back. Because when we have all these amazing protocols, we go through our double-dose dapsone, we get them on the right amount of Bartonella treatment and methylene blue, and then we're doing all these other things with the herbs and looking at the genetics and balancing these things out. One of the questions I always have is like, well, why isn't everyone getting better, right? Because we're really close, it seems. And I think some parts of that have to do with the mental, emotional, spiritual impacts of this. And to be honest with you, I'm kind of getting sick and tired of hearing about all the parasites in Lyme and this world. And because some people have them and we need to treat them. But I think the vast majority of people actually have more of an energetic parasitism from all of this. And sometimes it's from people like myself and yourselves by accident because we're trying to help them so much better, but we forget the fact that it's not all about the infection, it's about them. So we're really going to kind of talk about that so that we can really help those people fully heal. And for any of the practitioners out there, I really like what Allie's talking about is getting out in front of people and doing things, getting your information in front of others. And so one of the things you might notice is I've got my fancy little camera there and my little microphone here. And one of the things I was told a long time ago is record everything you do. Because you're going to say something at one point that's going to trigger something for you that you want to go dive deeper into and share with your patients. You might want to share it in your newsletter, you might want to share it online. And so I'd really encourage you to realize how powerful you are, both in the words that come out of your mouth, driven by your heart, and then also the example you lead for your patients and all those around you. So take the opportunity when you can to share your knowledge, being on a podcast, starting a podcast, doing a blog, or a Substack, as Dr. Horowitz was talking about, and really look at that, you know. And so I really want to spend a little bit of time and make this a little bit different, like I mentioned. And we're really going to explore these principles. And I want you to have an experience of how you can see a dramatic change in your patient outcomes, and also really a deeper sense of professional satisfaction. Because so many of us who have done this, anybody here in the room go like, hey, like today was hard and maybe I don't want to really do this as much as I had said before. It's a little too complicated. And that thing that Rich just told me about, yeah, no. And then that stuff that Lindsay was trying to tell me to do, there's like 75 different characteristics of an herb that I'm not really sure I'm going to be able to handle. So this is a place where we're going to be exploring not just knowledge, but finding practical tools and strategies that really help to integrate body, mind, and spirit. And as we move through these topics, I really want to invite you to kind of just take on what resonates with you, knowing that it's going to naturally stay with you. And by the time we're done, you're going to get the information you need. And you may not get it all today, right? A lot of times I think we go to a conference and we think we have to remember everything when we leave the back door. But the reality is we have to remember it at the right time when our patient needs it the most. And I know you're going to do that today. And I find it's funny sometimes. We come to these spaces, right? And we're eager to learn, we're full of ideas, and then we're getting overloaded and we're getting tired, but we often forget to take a moment to settle in. And right now, as we're gathered, you could, together, finishing up this conference, you might notice that it just feels good to let your body relax. Can you hear that and feel that in the room? I mean, when was the last time during a conference you took a moment to take a deep breath, allow your shoulders to sit down, and just allow the learning to happen naturally, And maybe it's like just kind of feeling your feet on the floor or your pelvis in the chair. But it's amazing that when we take a moment to relax, you can actually create the space for new ideas to flow in without a lot of effort. The important part is to remember that you are leading your patients by example. And if you can't do it yourself, how the hell are they going to do it? Because they're coming to you because they don't have a good enough example yet. And you're going to be that catalyst to help them heal. So even after this long weekend, you're going to be able to focus, feel energized, and really learn everything you need to. And what's really cool, I learned this with my dad after he passed away about 3 years. You can rewrite the past and create a whole new story. So even if you miss something like yesterday, you can right now just decide you're going to remember it when you need it, and it'll work. And this is one of the things I think is so really important. So there's really no pressure. Just chill out, have a good time, and hopefully there will be no traffic on your ride home. So I wanted to start off talking about James, and he's a 12-year-old boy who had symptom onset consistent with PANS and PANDAS when he was about 9 years old, right? And they found evidence of exposure to strep and mycoplasma, cytomegalovirus, and possible Lyme, right? So he had 41 band on an IgM and an IgG from Stony Brook, but they said, hey, maybe Lyme. He also had an ANA that was 1 to 40, and he had evidence of gluten sensitivity, and the doctor who was seeing him wanted to look further, but the parents were like, well, we're not going to be able to do that, so we're just not going to look. And so they left him on gluten despite all of his antibodies. And he really had this progressive behavioral regression, right, as Rosalie was speaking about this morning. He had a lot of aggression, especially with his siblings, and there was conflict. And a lot of like what Lindsay was saying is sometimes it's one person in your family or one person at school. And so we were seeing a lot of this with James. And he did a lot of throwing objects, and occasionally he'd try to beat the crap out of his mom and stuff like that. Again, like we were talking all weekend with PANDAS, we see this heightened sensitivity to different foods and restriction. And he also had intermittent sort of waxing and waning, mouth tics. And so very commonly he would have things like regression to baby talk and kicking and hitting as well. So his brother and his mom often were the brunt of all of this. And really what was interesting was they thought he had Lyme, they thought he had mycoplasma and the strep, as I said, and they just kept treating him with all kinds of everything. But the problem was he'd get a little better, then he'd get worse. He'd get a little better and he'd get worse. And they worked him up like crazy for Lyme, they worked him up crazy for Bartonella, and it was just this waxing and waning thing over and over. And so then, it was interesting. They even tried things like LD, they didn't try Helminth though, so maybe go back and do that. But LDN, SPMs, nutraceuticals across the board. It was really interesting. They've done all the stuff we talked about, but it wasn't really working. And so with all these relapses, they came to me and they said, well, what have we missed? And I said, well, one is you've missed a comprehensive workup. But they're like, but wait, I did those 4 Bartonellas at Galaxy. I go, that's really great. But you're treating Lyme based on borderline, if at best, testing. And then on the other side of it, you haven't tested for babesiosis. And so I finally got them to do the IGeneX 4 immunoblot panel. We found that he had Babesia microti after like 4 years of symptoms of treatment. We found out that he was G6PD competent and he had a normal methemoglobin level, which is an important thing to look at before you do things. And we added Tafenoquine, and within like 3 weeks, he was a brand new kid. And now we're 8 months past his initial dosing of Tafenoquine, and James is essentially back to being about 90% normal. So it's not really just about, and his mom's like, oh, he's like phenomenal and doing great and everything like that. The piece that's so important here is a comprehensive diagnosis. And it starts with, as Dr. Horowitz was talking about, and I think everyone kind of alluded to, is you got to do a great history. You got to do a great physical. And it doesn't matter what the labs show, but they help. And I remember what Ray Jones always told us was Lyme is a clinical diagnosis supported by laboratory data. It doesn't mean Lyme's a clinical diagnosis, screw the lab diagnosis, right? And we really do need to get all of those, an accurate diagnosis, because in this case, it was the only thing no one had looked at, so I was playing good Monday morning quarterback here, but it made a humongous difference in this kid's life. And basically he's like participating in family conversations, his sense of humor is returning, his regressions have stopped, and he's back to being a normal child. And I just think that that's such an important piece, is to, before you dump into how to use Tafenoquine or how to use Dapsone, figure out what the hell's really going on. And I really like that so many people have highlighted that mental emotional piece of this. If we don't look at traumas, if we don't look at the other, because we're always talking about like, oh, the parasite of Babesia, right? That's a parasite too. But the thing is, what about all these other aspects of that total human being that were there? And as an osteopathic physician, you heard Neil talk about like, always go see a traditional osteopath who practice cranial osteopathy. Well, the thing is, we look at the body as having a triune nature, body, mind, and spirit. But the big part about that is we talk about body, mind, and spirit separately, but you can't do that in physiology. If I kick you in the shin, you're going to have a mental reaction to that and an emotional reaction to that, because you're probably going to say, why the hell did you kick me in the shin? And so it's really important to understand that the physiology of the body does not function separately. And that's why we're going to talk about all these things together. And one of the things, we were talking about here is just like, why is it so complex to treat all these things simultaneously? And I think all this conference, we've heard from multiple people that there's so many different things going on. How we need to just start to prioritize these and treat these. We have limitations to our traditional treatment approaches, right? So we have treatment resistance, lingering symptoms after quote unquote effective treatment, which is why so many of us are using this, term of like sustained remission rather than eradication. And then this need really for holistic healing, and it includes the body, the mind, and the spirit.